All right, so we're going live on Zoom now. I'm just going to make sure we've got this. Okay, and we're live on Insta. All right, so we're live on Instagram now. Hey guys, welcome to the CPD Junkie podcast lockdown special, where every night at 8 p.m. we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who have already done it before you? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to get the full access features of the site. I'm your host, and tonight we are joined by Jeff Bridges. He is a qualified physiotherapist, graduated from Otago University, New Zealand in 2009. He worked in musculoskeletal private practice until 2015, with a special interest in TMD, before he moved to Griffith University in the Gold Coast to study dentistry, graduating in 2020. His father was a dentist as well, where Dr. Jeff previously worked for many years. Currently working full-time at Shellharbour City Dental private practice and loving it, looking to continue with general practice for a foreseeable future. Dr. Jeff Bridges, welcome to the show.
Thanks very much, mate. Thanks for having me.
So, you've only graduated in 2020, during a time of COVID lockdowns. Tell us about your CPD journey so far, before and after graduating. I mean, where have you looked to find and complete CPD?
Well, I guess during university, you've got to do a ton of work. And amongst the study, I always tried to find other ways I could just top up, the syllabus that was given to me. So, from podcasts to YouTube, to shadowing a lot of dentists, I tried to really immerse myself in other avenues that were available to try and, really piece the puzzle together, if you like, so that when I graduated, I was capable and I knew kind of what to expect. And I think probably the biggest thing that I could recommend to others to do is to shadow or go in and see the real thing. I think by watching other people perform dentistry, that's invaluable. As a student, you can sign up to courses and things, but if you watch someone do it and see how efficient and how easy they make things look, you can take that back into the uni setting and kind of go from there, which I really enjoyed that side of things. So.
Yeah, so I mean, you mentioned a few things there. So you listen to some podcasts. You try to do, what kind of podcasts were you kind of listening to?
Well, I think, there's a number of podcasts available, but I always kind of gravitated to Dentistry Uncensored with Howard Ferran. That's been going on for yonks. He's always asking the same questions, so it gets a bit old. But more recently, kind of over the years, Newbie Dental podcast, it's been good. Dental Head Start, they're very insightful. Right Global, Savvy Dental podcast, with Jesse Green. There's a number of podcasts that I think all offer different things, but you want something suited to students. So the clinical tips are the ones that I was searching out for, as a student, and less of the business side of things per se.
I see, yeah. And where would you say the online kind of stuff, CPD, that you were looking at, or like in-person CPD, before or after graduating? I mean,
I think as a student, you don't know what you like. And I still kind of don't know what I like just yet, even though I've been working for 6 months and I've been full-time and busy in that period, thankfully. Maybe a little bit quieter at the moment with COVID. I'm still kind of finding my feet and just setting the foundations up in terms of being able to kind of be across multiple disciplines and kind of find within those disciplines things that I like after doing them numerous times. I think, people ask me, what CPD are you interested in? What have you signed up for? Well, in the first couple of months, you may not have the income to support really expensive courses or those long-winded, graduate courses at universities like King's overseas. So I'm looking more, a couple of day courses in the areas that I see the patients that I'm treating in my practice need. And thankfully, the practice that I'm working at, the demographic supports a really wide range of general dentistry. So, I've got my eyes on courses related to kind of more wisdom teeth stuff, maybe doing a little bit more aligner ortho, because I've just started to take on some Invisalign Go cases that I've been trained in, but it's early days. So I guess I'm just finding my feet, and this next 6 months is going to be where I'm going to look to implement more courses. And I think CPD Junkie is that kind of place where you can go and really look at the whole plethora of courses that they're offering these days. There's so many.
We haven't paid him or anything to kind of say that, but thank you for the plug.
No problem.
So yeah, I guess you've mentioned a few things. You've looked into your early days into it, and you're kind of feeling your feet for what you might be interested in. I think a lot of new grads are definitely along that kind of same boat. So definitely don't feel like you're the only one in that kind of situation. Let's talk a little bit about the physical therapy side of things that you've mentioned in the past. TMJ pain. Tell us a little bit about that experience, and if that's been able to help your understanding in dentistry and some of those issues when you see those patients.
Yeah, for sure. Look, I think I took on TMD as a physio because I wanted to try and clarify whether I actually wanted to have my hands in people's mouths and do that sort of thing. Before I got into physio, I wanted to be a dentist. So it was always the end goal for me to be a dentist, but I was fortunate enough to work in physio, and I think that actually helped me become potentially a better dentist in the future. With TMD as a physio, we approach it, I think, far differently than dentists do. We as physios treat all joints of the body, obviously, so we approach the TMJ like another joint. We're there to, assess its range of movement, see if there's any obstruction, like, disc derangement, things that you see commonly. And, if it's not heavily inflamed, then we look to try and get it moving. And I think it's pretty well documented now that TMD responds to conservative management for the most part. And if you give it time and if you give it time and you take care and you give them some simple things to do, things will over time get a lot better. Where in dentistry, sometimes our initial thought is to get it immobilized, put a splint on, and cross our fingers and hope for the best. So having taken that experience from physio, I'm more comfortable taking on TMJ patients. I'm more, more reassuring to say to the patient, look, things probably will get better over time. You just got to give it some time and treat it like a joint it is, not overcomplicate it.
Yeah, sometimes we're a lot of our patients and a lot of the mentalities, quick fix, right? They just forget that the body just needs time to heal. We've noticed that you do dry needling, Botox, fillers. Tell us a little about where you learned that, and do you still offer that to patients now, or are you looking to do some more CPD on that?
Yeah, so during the university course, I was, given the opportunity to do a Botox and fillers course through Griffith. And now it's been kind of endorsed by the ADAQ. So that's good to see that, the professional body's getting behind the course, and people may be a little bit reluctant to go into Botox and fillers. For me, I primarily wanted to do it for the Botox. A large proportion of the TMJ patients that I saw as a physio, they had a lot of muscular dysfunction, really tight, heavy, big masseters, evident that they're probably doing some sort of parafunction. And I wanted to offer patients in dentistry the option to have some Botox to kind of just tone down the muscles a little bit, to supplement other avenues that they may have already going. So I don't really have a desire to really do a lot of fillers. I think, it has a place maybe in aesthetic dentistry. However, the Botox is something that I've been doing with my patients just to try and give the muscles a bit of a break. And, with the dry needling, I found that to be particularly useful just in general physiotherapy. But when I started to do some dry needling for the masseter temporalis, lateral pterygoid for TMJ patients, they found a really, really good benefit with that, where it was more into the trigger points of the muscle rather than me doing kind of external soft tissue massage for 15 minutes. I was able to achieve, I think, better results with dry needling and try and settle the tone of the tissues down, which is slightly invasive, but you're not injecting anything like fillers or Botox. It's basically just a dry acupuncture needle, which helps.
Sure. Are you looking to plan on doing some more CP on that, or just, you're kind of happy with that where you are at the moment with that space?
Well, I did level 3 advanced kind of dry needling, so I'm able to treat all muscles of the body in terms of dry needling. It's not something that I do routinely in my dental practice. I'm happy to refer TMJ patients for physio if I think they need them, but I do offer just general advice in regards to exercises and if they're a clear bruxa, then I'll give them an occlusal splint, just a thin maxillary one, and that seems to protect the dentition, whilst I can kind of get them to look at other avenues. So yeah, that's where I'm at with all that stuff.
I wish Adelaide University, where I graduated from, offered that during that time, but we'll have to wait for the next time, hey? So, of all those CPDs you might have mentioned, what would you say has the biggest clinical impact on your dentistry today?
I would say the Invisalign Go course that I did with Brett last year has been a good offering for me so far in terms of just getting into some initial orthodontic work. There's a few patients that I've been looking out for that have some minor, alignment issues that I've been happy to say, this is something that I can actually do for you. And there's another dentist in my practice who does a lot more orthodontic work. He's done Derek Mahoney's course. So I've been able to kind of liaise with him and go, right, is this a case that's suitable for me, do you think? And then, just get started with some initial ortho work. It's not something that I want to go deep into right now, but I would say the Invisalign Go course has been surprisingly kind of useful to try and potentially offer that ortho, but also that pre-restorative ortho that I want to kind of tie into my restorative side of things. So, yeah.
Yeah. Would you say a lot of recent graduates or new graduates feel like they, feel like they need to kind of get into that kind of space?
I think, Invisalign is one of the most famous brands in dentistry. People see it everywhere. They know about it. I think there's this big drive, or graduates know about, the potential ortho craze out there. I'm not saying that it's what I've seen, but I think most graduates want to kind of undergo some aligner training just so that they can offer that as part of their arsenal, I guess. I think the Invisalign Go is a really good starting point where you don't need to kind of change the molar relationship or anything crazy. It's a safer avenue to try and just initially get into it without, overburdening yourself and getting unstuck.
It's nice that you have someone kind of there to kind of support you as well, in those situations, in case selection, like you just mentioned.
Oh yeah, I think that's everything. Case selection. There's, I guess, every discipline you're looking for potential patients that you can take on. I'm fortunate enough to have really good support at my practice with no pressure, and they're potentially able to kind of step in the room and assist when I need. So I've been getting comfortable with being more uncomfortable. And I think, there's a level of stress that is healthy, and then there's a level of stress that you don't want to take on and bite off too much. And I think now that I've been working in, health as a health professional for many years, I'm more aware of the types of patients that I should be getting involved with, and, others that I should refer.
Yeah. I mean, let's be honest. My first year definitely was also hard. So naturally, I think we all go through that same kind of journey.
Oh yeah.
Yeah.
Look, I'm enjoying the process. Yeah.
So you mentioned that your dad was a dentist. He was known for his close relationships with his friends, his patients. Sorry. What role did he play in you wanting to become a dentist? And what were some teachings you gained from him?
Well, I grew up in a family of dentistry, so I was kind of exposed to it from, as long as I can remember. I was in the dental practice quite often, playing with wax and being in the lab, getting my hands into all the materials and things. So I was never, I guess, scared of the dentist, never had a bad experience just because it was so, so familiar to me. But funnily enough, my dad was a really kind of handy carpenter, if you like. So I kind of grew up building houses and always on the tools with him. And then that kind of was very similar to the way he did dentistry. He graduated back in a time where, they potentially didn't use any gloves. All the materials were really different. And I saw, even from a younger age, how things have changed over time in terms of the profession. So I've taken some of the old school approach that he used to do, and it was effective, and patients loved that familiar environment that he created. And, I've taken that with me now into this new modern age where, I've got access to a CEREC machine and all these other cool gadgets. So, it was probably just being so hands-on the profession that I was attracted to, because I was always wanting to do something with my hands. I play drums, I play guitar. It's always hands-on for me. And that's why dentistry was the perfect fit, I thought.
I mean, following on from that, what else, who else has been the biggest mentors or idols in your career path and why?
During my uni course, I shadowed this dentist called Mark Miller in the Gold Coast. And he was kind of old school like my dad, similar age, but he had a really, really good professional practice that was really busy. So I used to go in there like once a week and shadow him. And he used to do a range of, general dentistry that I learned a ton from him. But just thinking over the years of the pages that you see on Instagram or Facebook, obviously everyone knows Lincoln Harris. He's done a ton of educational stuff over the years. I was fortunate enough to go up to Bagara and kind of watch one of his presentations. But I've had contact with Dr. Johan Choi and Dr. Barat, like I spoke about with the Invisalign Go. These are sort of practitioners that are really humble, really, giving of their time. And I appreciate, the contact that I've had with those guys over the years. And you can see how clean their dentistry is. And I'm a big believer that, everyone's got their own journey and everything is repetition. So I've been more focused on just gaining repetition over the years, whether it's observing people or, seeing cases online. You just see a lot of teeth. You kind of get a feel for, how teeth should look, what kind of cases are possible. And, that kind of gives me a target to shoot for in the future.
So, what does your current ideal clinical day look like at the moment? Types of procedures you might be getting into?
Yeah. So it varies, general practice, you take what you can get as a graduate. But look, we've had a CEREC machine for a couple of months now. So rather than me temporizing for 2 weeks, I've been doing some same day crowns, which has been really good communication tool for patients to say, look, we can offer you a same day crown. And patients seem to like that. And I like the design side of things. So I've been enjoying that side. But I do a range of, just general restorative. I see kids. I've been doing some dentures, surgicals, taking some wisdom teeth that I need to flap and gutter, perhaps not section, but, some tricky eights I've been taking on, dentures. So I would say most disciplines, bit of perio. Depends on the day. Today I just did some restorative, some secondaries, peds, restorative, and then yeah.
Sounds like you're getting pretty knee deep in there, hey, in your first 6 months of it.
Yeah, look, I think I've touched on every discipline. It's lucky that I have a boss or a mentor who does general dentistry to a high standard in most disciplines. Like he does some implants as well, and that's maybe something that I want to do later on because I do like surgery, but I also like restorative and aesthetic dentistry. So I've been able to take on cases that I am slightly uncomfortable with, and then get some assistance to either kind of complete it if I need it, or refer within the practice or onwards. So, I've been really lucky to land on the practice that I have. I think. Yeah.
So, I mean, you've kind of mentioned, where you kind of want to go, but, what would you say you want yourself to look like, the day to look like in 5 years' time?
It's a good question, mate. It's hard to know, really, isn't it, in 5 years?
Yeah.
I would say I definitely want to be more proficient with this CEREC. If I intend to stay at this practice that I'm at, and I know that CEREC is kind of it's been around for ages, but I think the system is quite user friendly, but still allows you to be kind of creative and take on some larger cases where you can really design and implement the type of dentistry that you want to do. So I'd like to take on some further CEREC training. I funnily enough, want to do a little bit more endo training, just so that I feel a bit more comfortable taking on some of these cases, particularly molar endo. But I would say in 5 years, a combination between some surgery, indirect kind of aesthetic dentistry, maybe some ortho from time to time, but I probably wouldn't be doing, any fixed ortho. So I'm happy with the variety of general dentistry. I think,
Yeah.
Physio has a lot of variety, and so does general dentistry. So I have no real desire to specialize at this stage.
So is there any particular CPD that you are interested in, or you got your eyes on? Or, I mean, you've mentioned it already, CEREC is some things, endo is some things. Is there any particular endo courses that you're particularly interested in? I mean, I think what's good in what you're talking about is like you're covering a lot of, very bread and butter stuff. You want to kind of make sure you've got that before you're kind of jumping onto some of those bigger ones.
Totally. I think what's the point in trying to specialize at this stage when you don't really know kind of all the nuts and bolts? I haven't done enough general dentistry to know what I'd like and what I don't like. I think, I've been exposed to so much podcasts, or just, I guess I'm a little bit wiser in my old age, if you could say, to know that, it's a process. It takes time. There's no point rushing it. Enjoy the journey. If anything, I'll be happy to take on something like Dr. Hassad's, case acceptance, communication style courses, and kind of just go back to treatment planning, or, just tying in those sorts of things that perhaps we overlook. I can tell you, communication dentistry is way harder than in physiotherapy. Yeah, and treatment planning is important in both professions, but dentistry, if you can't kind of communicate the treatment plan, patients get a little bit lost. So
yeah, well, they start to not believe what you might be saying, or question your ability.
Yeah, absolutely.
So I guess that's probably most things that we've probably covered today. I think, Dr. Jeff Bridges, thank you for coming on the show today. If you could let the people know, how they can find you, or, what is going on in your life at the moment. Probably not too much with COVID and everything right now, but,
Yeah, look, you can find me on Instagram, J Bridges Dentistry. I sometimes post dental cases on my stories. You'll find me playing guitar and all sorts of other random stuff. But yeah, feel free to reach out and get in touch. Happy to have a chat. I look forward to the coming years. It's an exciting time, I guess, to be in the profession, and there's ways to communicate with other people, even in COVID. So thanks for the invite. Appreciate it.
Well, our pleasure. Thank you again for coming on the show. Hope you have a good night.
Cheers, mate.